is the most appropriate initial management for this patient? 8-year-old boy is brought to the clinic by his father, who reports that his son has been complaining of left hip pain for the last month. Patient has been limping, occasionally experiences pain in the left knee. In examination, the left hip has decreased range of motion. He experiences discomfort on internal rotation. Radiographs of the pelvis demonstrate a flattened and fragmented left femoral head. I can't think of this as like the peg calf, so I might be messing up how to pronounce that disease. I mean, I remember going over these for family medicine because they asked them on my shelf. Um, I'm pretty sure that it's like almost anything similar. So he had imaging done. I don't think you're going to go for initial management. Corticosteroid injections, I like. Open reduction, internal fixation is a little extreme. Physical therapy and NSAIDs seem like a good choice too. But I think if he's having fragmented left femoral head, that might warrant like surgical intervention.
Okay, good.
Um,
Okay.
so that's why I'm like, okay, I don't think like PT and NSAIDs aren't gonna like fix this. I don't think corticosteroids are gonna fix this. Non-work bearing crutches like a lifestyle thing. I think you're gonna scope it, not do an opening reduction and internal fixation because I would scope it. Oh, it
So
is. Oh, it's no.
I
Okay.
don't know. Let me see. Kind of this non-whipping left hip, blah blah blah, flatten. So
Is
leg.
it leg? Okay, it's that
Yep.
weird leg calf. I didn't know. Okay.
Yep. This condition is self-limited avascular necrosis, you typically affecting 4 to 8 initial, minimize weight bearing hip to prevent further and allow for revasculation. Let's see. When do you open this? For so here, but not the initial management. So okay, so I don't actually know. So actually, this makes sense. So usually it's like avascular necrosis of the head, right? So
Yeah, that's what I was thinking about. And
yeah,
you don't. I'm wondering. You don't scope that. You fix it.
I guess you leave it alone. Let me make sure here. Let's see. Treatment for let's see here. Assistant treatment for leg.
Yeah, let me pull up something too. I have a note about this somewhere.
Yeah, rest, physical therapy, and sometimes brace to improve. So it seems like you want to try it first because I just remember it's avascular necrosis, meaning that head, the femoral head doesn't have enough vascular supply, right?
Okay.
So it's degenerating. So actually, probably surgery is not your best option here because if you fixate it, but you don't have enough blood supply, then it'll probably make
Mm-hmm.
it worse. You get what I'm trying to say?
Okay. Makes sense.
So yeah, so activity modification, physical therapy, anti-inflammatory. So probably best here is to kind of not put weight on it so you don't destroy it even more. Allow your body some time to make new vascularization and heal it itself because 8 years old, you're still developing, right? And so
Okay.
actually probably putting a plate on it or trying to kind of put it back into place is probably going to do more damage than good because you don't
Okay.
have enough blood supply here. So
Okay.
all right.